Why me? Why is this happening to me or to my child? Did I do something wrong? Or should I have done something differently? You've probably asked yourselves these or similar questions. That's how it is for pretty much everyone who has cancer themselves, or who has a child with cancer. These questions about meaning or guilt are often part of it when you receive a serious diagnosis like cancer, on top of all the other worries and fears you already have. And they can be quite persistent. That is because for profound questions, like why, there's often no simple answer, or no answer at all, and there's neither a practical nor a medical solution for them. So in the truest sense of the word, they're unsolvable. And that's also the reason why these questions sometimes won't let us go, and we keep mulling them over, whether we want to or not. But that means you can't just magic away difficult questions or thoughts with the right motivational quote. They are there, like unwelcome guests who suddenly show up unannounced at your door. And even if we send them away, they knock again and again. You can learn to endure exactly that, and over time, you can come to terms with these visits and find a way to deal with them. And you'll notice that when you face the difficult questions or thoughts openly, sometimes things can start to shift. We can try it out carefully now, even if it might not work. The easiest question to answer is probably whether you yourself are to blame when a child or adolescent gets cancer. Because no one is to blame. Because to this day, we still know very little about the causes of cancer in children. So it's not clear if you can even do anything wrong or right, like whether a specific diet played a role, or a certain lifestyle, or other factors that you have control over. That means it was never in your power to prevent this disease in any way. And yet many parents, or even adolescents, often have feelings of guilt. This has to do with the fact that we feel responsible for our own lives, or for the life of our child. In similar ways, you can also feel responsible for the healing process. The question, what can we do to make our child healthy again, can put you under a lot of pressure. The same goes for the therapy. You can't influence the chances of recovery. The treatment is first and foremost a medical task. But you can find out what helps you get through the treatment as well as possible. And that also includes finding a way to deal with this uncertainty. And it's similar with the questions for which there is no rational or universally valid answer, like the question of what meaning this all can have. Dealing with such questions is sometimes a process, that takes time. It's like traveling with a backpack full of heavy questions. It can make the journey more strenuous. Sometimes the first step is simply to acknowledge that these questions are now coming along with you, right? You just have to endure that at first, and as you go they can then change, or over time they might even become lighter. Yes, and for them to be able to change, it helps to look at them. And to talk about them, of course, that sounds easier than it often is in reality, right? That's why I now have a few more tips for you that can be helpful for dealing with difficult questions or thoughts when they come knocking on the door again and start to take over your mind. The most important thing, first of all, is that you show some understanding for yourselves. Tell yourself, it's okay that these thoughts are here, even if this is something you've never experienced before. Also, remember that you're not alone. There are others who feel very much the same, so it's completely normal. So consciously acknowledge these questions and allow them to be there. It can also help if you voice your thoughts openly and honestly. In fact, it's scientifically proven that those who find an open way of dealing with their worries and fears get through stressful life situations better. Vent your feelings and get things off your chest. Conversations can help you to clearly name your thoughts, to sort them, and to put them into perspective. It may also be that your conversations lead to something more, and that you can carefully approach some answers or a new perspective. For that, try to get other people on board who are willing to endure such difficult topics together with you. Without judging, and without just trying to talk the difficult things away. These can be people from your family, or from your circle of friends, or even someone from the treatment team. When it comes to the incomprehensible, to meaning, and to what gives you hope, a chaplain can also be a good person to talk to, even if you are not religious. If you're interested in that, there's a separate video on the topic of pastoral care that you can watch. So what's the takeaway from this video? How do you best deal with the questions of meaning and guilt that are weighing on you? You know now that it's less about finding answers and more about acknowledging that sometimes there is no answer. Sometimes the uncertainty that comes with that is very hard to endure when the world is no longer as explainable as it was before. But you can learn to deal with it by allowing this uncertainty to be there, by permitting it, finding words for it, and giving it space. And remember, the psychosocial team is happy to support you in finding a way of dealing with such topics that is right for you.